I never, ever wanted to be a physician. There were no doctors or medical folks in my family, and there was four of us. There was my parents, myself, and a brother 2 years younger than me named Donald. When I was in 8th grade, I still remember the day, the night, all the details. My brother passed away suddenly out of the blue. He was 12 years old. The diagnosis was Kawasaki syndrome, and that was something that people weren't familiar with. What it is a late-stage manifestation of a viral illness that can occur. You know, my mother wouldn't smile in photos for the next 20 years. I remember those. I see those photos. But I have to say that experience totally transformed my life, and I decided I wanted to pursue pediatric cardiology at that point. Now, I didn't end up in pediatric cardiology. I thought it was a fascinating field. I just didn't like the field of pediatrics. Now, God bless the people who do, but that just wasn't me. I ended up not knowing what I wanted to do, and then stumbled upon oncology later. And this is what I practice now. So that really gets me down to things like, gosh, how could we have prevented this? If we had, access to advanced healthcare, could that have been prevented? And, these days, it's hard to rely on your physicians or the doctors you're seeing to really take care of your whole person. But Sir William Osler, who founded Johns Hopkins and, the last century, he said, a good physician treats the disease. But the great physician treats the patient who has the disease. I hear the word cancer patient, lung cancer patient, breast cancer patient. That sounds fine, right? That's not what defines the person or the patient. We need to use the terminology, the patient with cancer or the person with cancer, because that they are the center. They are the ones we focus on. And this happens in our patients every day. You get done with treatment, you go home, it's not back to normal. There is not going back to the way things used to be because something has changed. You've undergone treatment for your cancer. You've cured it. That's awesome. But there's a new normal. And I feel like we as healthcare providers need to be better in helping people adjust to the new normal. We have to be part of their entire journey. And I think those words resonate to patients. We have to not only cure them of their disease, their illnesses, but get them back to a point where we support them back into society, back into their family. Again, back in the early 2000s, this is only 2 decades ago, if I saw a patient with stage 4 lung cancer, you could come in and I could draw one of 4 different things out of a hat. And that would probably be as good a regimen to take, which didn't work very well. Survivals were less than a year. The side effects, not very good. And it seemed hopeless. Now it's totally changed. We run a genomic screening test on a small piece of tissue or in the blood. In about half of our patients, we will find a unique marker in the cancer that can be paired up directly with a therapy. That therapy now is a pill for the most part, and people are living years with advanced stage cancers. And so that is the approach of personalizing medicine. Each time we're thinking about a treatment, we have to start with the patient first. And this is where this personalized treatment comes in. You hear terminologies like patients fail treatment. That's insulting. Patients do not fail treatment. Treatment fails patients. Okay, so again, we're putting the nouns in the wrong places here. And then finally, this whole person care. I've been referring to this, right? We are going to start a huge program in integrative oncology. And what integrative is that naturopathic substances, aromatherapy, massage therapy, acupuncture, music therapy. This is where we can focus on people holistically. Give them the precise therapy that's needed, the precision therapy to treat the disease and to cure it, but then use integrative oncology as a warm, fuzzy blanket around the whole thing that will keep you warm, that will ease your soul and mind and get your spirits up.